Hey everyone! Today we're going to talk about something that millions of us experience, but often find really hard to put into words: anxiety. So, in the next few minutes, we're going to break down what it is, what it actually feels like, and maybe most importantly, how to start managing it. It's a question we all kind of face, right? We all get stressed, we all worry, before a big meeting or a test, or when life just throws a curveball at us. That's just part of being human. But there's a point where that everyday worry crosses a line and turns into something, well, something more. And understanding that line is so important because look at this number. We are talking about 40 million adults just in the US who live with a diagnosed anxiety disorder. That is a huge number. It makes it the most common mental health condition in the country. So this isn't some niche issue, it's a major part of our lives and communities. So to really get what this is all about, we have to go beyond the big numbers and the stereotypes. We're going to really dig into what an anxiety disorder actually is. Okay, let's dive in. All right, first up, what exactly is an anxiety disorder? Let's get a clear definition. The two words that really matter on this slide are persistent and interfere. See, this isn't about having a bad day or a stressful week. It's when that worry just sticks around. It becomes this constant background noise that gets in the way of your work, your relationships, your ability to just live your life. It's the intensity and the fact that it just doesn't go away that makes it different. And here is where we can really see that difference side by side. Everyday worry, it's usually tied to something specific, right? And when the thing is over, the worry fades. An anxiety disorder, on the other hand, can feel like it's just free-floating. The feeling of fear is often way, way out of proportion to what's actually happening, and it just hangs around, messing with your life. Now, it's really important to know that anxiety isn't just one single thing. It's more like an umbrella term for a whole family of related conditions, and each one looks a little different. So first, there's GAD, or Generalized Anxiety Disorder. You can kind of think of this as the worry about everything disorder. If you have GAD, you experience this excessive, ongoing worry about a ton of different things: money, health, family, work, and you often just expect the worst. For it to be a diagnosis, this pattern has to go on for more than 6 months and come with other fun symptoms like feeling restless, being exhausted all the time, or finding it impossible to concentrate. Then you have disorders where the fears are way more focused. Social anxiety disorder is this really intense fear of being judged or embarrassing yourself in social situations. And then you've got specific phobias. That's an intense and, let's be honest, irrational fear of one particular thing, whether it's flying, spiders, heights, you name it. In these cases, the fear is just completely out of sync with any actual danger. And then we have disorders that are defined by these sudden, totally overwhelming moments of fear. Panic disorder is marked by these out-of-the-blue panic attacks, and this is key, a constant fear of having another one. That fear can actually lead to agoraphobia, which isn't just a fear of open spaces. It's a fear of being trapped in any situation where you think escape might be hard if you started to panic, like on a crowded train or in the middle of a bridge. So we've gone over the different types, but what does anxiety actually feel like? It is a powerful experience, and it hits both your mind and your body in really tangible ways. Yeah, anxiety is a full-body experience. Psychologically, it's that constant feeling of dread, like something bad is about to happen. It's being on edge all the time, or not being able to turn off those racing thoughts. But it is also intensely physical. Your body's fight or flight system basically gets stuck in the on position, and that can mean a racing heart, sweating, shaking, dizziness, even nausea. It's this powerful mind-body connection that can be just completely draining. A panic attack is basically anxiety at its absolute most intense. It's this terrifying wave of fear that comes on super fast and peaks within minutes. People who have them often feel like they're having a heart attack, like they can't breathe, or that they're totally losing control. It is an incredibly scary experience, and it can feel like it comes out of nowhere. Okay, understanding the problem is step one, but it's definitely not the last step. The most important part of this whole conversation is knowing that there is a clear path forward, a way to manage these conditions and find real relief. And this right here, this is the single most important thing to take away from all this. While these disorders are super common, they're also highly treatable. There is so much hope. You are not stuck, and you are not alone. There is real, effective help out there. So treatment usually involves two main approaches, and they often work best together. You've got psychotherapy, or talk therapy, which is all about building skills to manage your symptoms and change those unhelpful thought patterns. Then there's medication, which can be amazing at turning down the volume of the symptoms, making it easier to do the work in therapy and just get through your day.
Now, within therapy, there are a few different approaches. CBT, cognitive behavioral therapy, is one of the most effective. It helps you retrain your brain's alarm system by challenging the thoughts that fuel the anxiety. Exposure therapy is a really powerful tool, especially for phobias, where you're safely and gradually exposed to what you're afraid of until it loses its power. And other therapies might dig a little deeper into how your past experiences are shaping your present.
So, what does that path forward look like? Well, it's actually a pretty clear process. It all starts with step one, talking to a professional, like a doctor or a therapist. From there, you can move to step two, exploring what kind of therapy is the right fit for you. And if it makes sense, you can then move to step three, talking about medication options. It's a structured, supportive journey.
And that brings us to the end. Just understanding anxiety is a huge first step toward having compassion for ourselves and for the people around us. So I'll just leave you with this question. Whether you personally struggle with this or not, what's one small, manageable step you can take for your own mental well-being today?